Hi, we're going to do the interview, and would you state your name and your personal information to the camera, just to be...
Sure. Name is Stephen Levy, Dr. Stephen Levy. I am a chiropractor in New York.
And my first question is, can you describe your symptoms prior to your visit to our clinic?
Prior to visiting the clinic, I have had some severe episodes of sleep apnea where I've stopped breathing, and my wife has shaken my body so I'd wake up, and she was concerned that I would stop breathing altogether, but thank God I didn't. I'm still here. But I'd wake up after I don't know how many episodes I'd have in the evening while I was sleeping supposedly, but they were pretty severe. I'd wake up sometimes with gasping breath. It didn't happen that often, but it did happen. Also, my head would be very foggy. I'd wake up with a headache, and my head would feel like it was not clear. I couldn't think clearly.
The second question is, have you ever been treated for any sleeping disorder prior to your visit to our clinic?
The only aspect of treatment that I've had is I tried a couple different devices in New York. They had like a tongue bulb, which would suck the tongue forward anterior, and that helped, but it would fall out of my mouth. So it really wouldn't stay in my mouth properly, so I gave up on it.
Okay. And have you ever seen any doctors with the snoring or other sleep apnea issues?
I haven't seen any doctors, no.
Okay.
I did try some other dental appliances.
Okay.
I did speak to some doctors for consultations, but I never saw any really specific doctor, sleep apnea doctor. I saw a dentist I spoke to.
How and where did you hear about our clinic?
Found out about the clinic through a relative of my wife. He comes here as a patient, and he recommended coming here highly. He recommended the doctor highly, being very honest, gentleman, and very diligent man. And, I concur. Your father is a gentleman, a true gentleman.
Can you tell me the after effects of the lingual frenectomy in detail?
After I had the frenectomy, I had 2 frenectomies, I believe.
Yes.
I could breathe a lot clearer, and additionally, I'd wake up with less headaches, which was a big plus.
Okay. Were there any discomfort with the surgery or complication?
I don't think any major. I mean, was it uncomfortable afterwards? I did the stretching,
Yes.
probably to excess more than anything else, so that wasn't really comfortable, but pain-wise, a massage is a lot more painful than
Okay.
surgery by far.
Okay. Next question is, can you tell me the after effects of using Kossomi, this device, in detail?
Using the device, it helps support the tongue, to me, in a better position when you're sleeping, to enable you to breathe better. So when you're waking up, hopefully once again, I wake up with less headaches and breathe better, and snore less.
Okay.
So far, I've tried some different devices that your dad made for me.
Yes.
And the most recent one, my wife was raving about, because she said that she could barely hear me snore.
Okay.
Breathing normally for the first time in my life through my nostrils, through my nose, as opposed to just heavy breathing through my mouth.
Okay.
So she was very, very pleased.
Okay. And when you're using this device, have you experienced any discomfort, or were there any negative?
Not real discomfort. I mean, is it a little uncomfortable or something that's unusual in your mouth? Maybe to some extent, but I wouldn't really say the word uncomfortable.
Okay. On a scale of 1 to 5, how satisfied are you?
I think your dad did an excellent job. I don't know if I want to give a complete 5, but maybe 4.5.
Okay.
So, I mean, I think he did a great job. Is there room for improvement in the future devices? I think it's evolving.
Yes.
And I think what he did right now, he worked extremely hard.
Yes.
I think he did an excellent job. And I'm curious to see what he comes up with in the future.
Yes. And do you think you understand the mechanism of this device and the frenectomy?
I think so.
Okay.
I mean, I read quite a bit online about it, and I think I understand it a lot more than most.
Okay.
Being a doctor myself,
Yes.
and I see how it affects the body in many ways.
Okay.
It's not just a localized area that it's really affecting. It's affecting the body in a lot more ways than people realize.
It wasn't on the sheet, but would you recommend this device and the surgery to other people who are suffering from this snoring issues or sleep apnea?
Absolutely. I mean, I wish I had this procedure done many years ago.
Okay.
If I really think about it, I probably should have had it in my teens or earlier if I had a problem. So I waited this long.
Yes.
I would wake up and my memory wouldn't be as clear, especially in the morning. And I think that now having the surgery, having the device, I think that will be dramatically improved.
Okay. Any other last comment you would like to address, or last questions that you have? Or
I don't have any questions. I just think that anyone who has a breathing issue, especially a snoring issue, should look into what your dad's doing. I think he's a pioneer in what he's doing, and he's doing an excellent job. People should really learn from him.
thank you for your support and help. And I think we are over with the interview. Thank you very much.
Very well.